Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Depression. Depression is often a term that is misused in the modern world. At its core, depression is a form of low mood that can last for a long period of time and often invades everything we do on a daily basis. While it could just mean feeling low and not up to your usual optimal thinking, at its worst, depression can feel like sinking into the bottom of the sea, locking down with an anchor. It drags us down and makes almost everything seem entirely worthless. It can become a severe issue, causing you to have thoughts of suicide and removing the will, desire, and energy needed to have a happy life. Part of the problem with depression is that the diagnosis is so layered and tiered. Like any other illness, depression has forms, including seasonal affective depression. Usually takes place in the winter and leaves you with a feeling downcast at particular times of the year. Parental and postnatal depression takes place either before or after pregnancy and can leave the parents feeling despondent. Dysmethymia, a form of mild depression that can last for 2 years, sometimes longer. A persistent chronic form of depression. Of course, there are many forms of depression which can make it hard to know what to do if you are diagnosed with this particular condition. Depression, after all, is a common disorder usually related to, but not limited to, feelings of self-doubt and worthlessness, a lack of desire to eat or sleep regularly, low energy and poor levels of concentration, poor mood and a lack of desire to take part in any activities, a drop-off in social engagement with friends, poor workplace performance. It can leave you feeling down and despondent, and is far more severe than simply feeling sad. It's a feeling of persistent helplessness. What causes depression? Should you feel any of the above, alongside other feelings such as a lack of sexual desire, thoughts of suicide, problems sleeping, consistent anxiety, and perpetual sadness, then you might wonder what is the case. Depression can be brought on by many different things, including lasting physical illness, long-term lifestyle problems and choices, traumatic experiences in life, including bereavement, familial issues, major life changes. Sometimes though, there is no one particular reason. Whatever the original cause though, it is important to find out what it is and what you can do with someone to slowly but surely put an end to these feelings. Looking for a psychologist in London? This could help you with your depression. Part of the problem is trying to work out where on a scale you might fall. Some of the tiers of depression include mild depression, the most common form of depression. It has a persistent but small effect on your lifestyle. It usually makes it hard to stay motivated at work and often means putting off and avoiding things that normally you would have enjoyed. Significant depression. A common form of depression too. This has a major impact on your day-to-day life. It often means that you cannot sleep right or your diet has become poorly managed. It usually comes in spurts and can lead various other problems such as suicidal tendencies and a desire to escape the mind. Bipolar disorder. Bipolar disorder is among the most significant forms of depression. It's like living in a roller coaster, immense highs followed by tremendous lows, all within a few minutes. This can lead to a very severe symptoms of lack of worldwide understanding, leading to making regular mistakes or acting in odd ways. These are all a common part of the problem with mental health and depression. How then does one seek help? Curing depression. Like many other forms of mental conditioning, you can find that curing depression is possible by opening up. Treatments such as cognitive behavioral therapy, CBT, is very popular, though we recommend that you see a therapist for help with this. Counselling. Counselling is a very popular form for treating depression, talking through the issues that led you to this particular point. Cognitive therapy. Mentioned above, this helps you to look at how you think and does what it can to help you identify negative thought patterns, so that you can address them. Psychotherapy, a popular form of treatment, it's an intensive form of counselling that often helps you to overcome depression, looking at various parts of your life to help decipher where problems stem from. Of course, you could also consider medication, though we recommend that you talk with a GP about this first and foremost. It's also important to note that every antidepressant carries side effects, while they often are free from such issues. Consider the style of depression that you are suffering from, arrange an appointment with a GP, and then consider your options afterward. The best thing that you can do is to seek help. Without assistance and support, depression is incredibly hard to beat. With the right support structure, though, you can find peace and solace through us at Hoxton Therapy. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast, which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course, when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.